So today we're going to demonstrate an adjustment here at Rimrock Chiropractic. We oftentimes will have new patients coming in with some apprehensions about getting adjusted, what that might look like. So we're going to demonstrate what a typical adjustment would look like. I'm going to use what's called the impulse instrument. It's a low force electronic instrument. So as opposed to doing the hands-on adjustment or the hands-on manipulation, this is much less force. And a lot of our patients prefer that, although we can do some manual adjusting as well. So for today, we'll be demonstrating with the impulse. So what I'm going to do is go through a typical analysis for an adjustment. We'll do the adjustment so that you can see what that looks like. So I'm starting with a leg length check. I notice that there's a leg length discrepancy, and so that gives me an idea of what may be going on here. So I notice there is a subluxation in the pelvic area, so I'm going to demonstrate what a pelvic adjustment would look like with the impulse instrument. So we're going to come into the left SI joint. I have it on a medium setting. I notice after the adjustment, the leg lengths have evened up, so the subluxation has been corrected. Next, I'm going to demonstrate a thoracic adjustment. We're going to be adjusting the T6, T7 area. And lastly, I'm going to demonstrate a cervical adjustment. Cervical area is the area of the neck here. Again, oftentimes new patients coming into the office might have a little bit of apprehension about having their neck adjusted. So this is a really nice low force way, a real gentle way to adjust the cervical spine. Now doing a post check, I see that the leg lengths are even. We've adjusted the cervical spine, the thoracic spine, and the pelvis. So now the patient is subluxation free. That demonstrates a low force, gentle type adjustment. We can use this adjustment on infants, a day old, 2 weeks old, all the way up to my grandmother, 95 years old. Very gentle way to adjust the spine.